right, so we have our lovely patient here with us today who is a beautiful lady. She's 84 and you can never tell. And what we're going to do is treat a few different things. So the first thing we want to treat is an area of scar tissue just along the nasal vestibule. She's had some Mohs surgery in the past, so there's just a little bit of fibrosis there. Now, a medication called 5-fluorouracil works really well to help with these kinds of fibrotic areas. It's not like Kenalog or steroid injections, which have a little bit more side effects, especially if you're injecting more superficially. So just close your eyes and just let us know this is a sensitive area. So I'm just going to do a little bit of a pinch to distract you a bit, and pinch, 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 and let me know if you need me to stop. You can just kind of go intradermally and inject a very small volume. So that's about a 0.05 milliliter, and that works really quite well. So as we can see here, there's a beautiful jawline overall, great chin projection, great sharp jawline, but it's normal to lose volume in the lower part of the face here, and it creates what we call in aesthetic medicine some marionette lines and some volume deficiency here, which is really amenable to filler. And what I'm going to be using today is a more long-lasting filler. It's called Radiesse. It's hydroxyapatite, and technically it's semi-permanent, so it's good when you're injecting deep. We don't want to go too superficial. So I'm going to use a cannula technique today, which is a little bit safer in some hands than a needle, although I use both. I like to use needles a little bit more superficial, and when we're going deep, we use the cannula. So we create a little stab incision, and from within that little stab incision, we can introduce a cannula like this. So what I like to do is inject using a bimanual technique, and open your mouth please and close. And so doing it this way, I can feel exactly where the cannula is going, and I can guide it in the depth that I like, so it's not too super. When we're injecting, I like to have multiple stripes in slightly different layers so that you don't create like a lumpy area where you just have a bunch of filler all in one location. By doing it this way and massaging aggressively, we can ensure that the filler is volumizing the area in a more homogeneous way, and you don't have just little areas of lumps and bumps. My dear, how are you feeling? Are you all right? Good. Thanks.
Very gentle.
See, I'm even worse than my dentist asking her questions with my fingers in her mouth.
Okay, I won't worry.
Okay, we'll give that. All right, so we've injected about, let's see here, about 0.7 cc's. It's not even a full syringe of Radiesse, and Maya, just smile a bit. So you can see that it elongates the smile and really volumizes that area well. And we're going to do the same thing now on the other side. Perfect. Now we're doing the other side again with a cannula approach. We're going to come up, and let me know, my dear, if you feel any discomfort, and open your mouth again and close. So again, we use a little bimanual technique. I want to feel exactly where the cannula is, and we start putting multiple stripes, low volumes at slightly different depths, so that again you don't get any lumping. I want it to be very thin little aliquots of filler, so that way they look a lot more natural. And lots of massaging helps the filler get integrated now a little bit more naturally, so it doesn't look lumpy or bumpy. Okay, and close. As I was saying, so someone with great chin projection and volume loss here, it's really nice to come in with stripes at this angle up towards the corner of the mouth. Again, it helps elongate the smile and volumize that area, and open and close. And just come up at a slightly deeper angle. Sorry, are you okay? Just coming a little deeper now. Okay, good. And again, you can decide depending on which way that's pointing, whether you want the filler to go upwards or downwards, right? Or sideways. Okay. It's a little deeper. Let's see if that